The 32 adolescent girls from Adamawa State participating at the 4-year initiative launched December 2024 by the EU, UNICEF, and the Adamawa State government to strengthen access to reproductive and adolescent health in Nigeria during the International Adolescent Health Week 2025 have identified menstrual hygiene, safe space, absence of confidentiality, lack of empowerment, and the inability to speak out as some of the major challenges adolescent girls are going through in Adamawa State.
Menstrual hygiene is a basic, it's the most important issue adolescents do face in the community. So they spoke whereby they want to be empowered for them to be able to create menstrual pads by themselves, that even ideal, you are at home, you can sit down and make your stuffs. Because without having these menstrual kits, that's when you will see adolescents going out there trying to go astray or leading themselves to gender-based issues just to get that menstrual pads.
Lack of guidance and communication. Like when we are being guided, like there are some adolescents that they don't feel free to open up to speak to their older ones, to their parents. So, and due to that lack of that guidance and communication, some parents don't feel free to talk to their children. So in that aspect, it leads them to sometimes to go out and get wrong information from others, which is very bad.
Other challenges include stigma around mental health issues, which can prevent adolescents from seeking help, insufficient adolescent-friendly physical and mental health services, and the investment in terms of budget, human resources, infrastructure, and variability in awareness and capacity at local and community levels. The girls are advocating for frequent awareness, empowerments, and engagements with peer educators, youth ambassadors, which can help reach more adolescents and make messaging more relevant, using toolkits, social media, partnership, governments, NGOs, schools to multiply impact, and integrating adolescent health into other ongoing public health, education, or social programs.
When they are empowered, the rate of adolescents getting pregnant and also getting infected will totally reduce. So we are looking for that all the health facilities in the LGA should have a safe space that adolescent will speak out and his voice will be heard. And we also talk about confidentiality, whereby whatever the adolescent should discuss, it should stay there. It shouldn't be told outside, and they shouldn't be judgmental.
I don't know if there will be a way where parents will also be trained in a way that they will bring their children close to them. They will feel free to talk to them rather than going out to meet their peers, which at the end they will give them wrong advice that will end up maybe being harm to them. Some will even rather lose their life due to that advice that they will give them out.
Adolescence is a critical developmental period with rapid physical growth, emotional and psychological change, identity formation, peer pressure, etc. Therefore, what happens in these years often shape long-term health, economic and social outcomes.
A lot have changed, and initially I'm one of the adolescent members here in Adamawa State, that the youth vanguards here in Adamawa State. We go about and educating a lot of adolescents in our community, in our various communities, of their rights, of their self-esteem, menstrual hygiene, and a lot of things.
The International Adolescent Health Week 2025 is a grassroots global observance focused on adolescent health and well-being.
Yeah, the whole reason of why we want them to come here, why we want them to raise the challenges, is to make change. Is for them to be a voice, but also we want them to be a part of the change. We need them also to be part of the change. We need them to hold us accountable, to ensure that now they have raised their voice, they have raised their concerns. Now they also need to know and see that we are actually trying to do things differently to support them. But they also need to be part of the change. They also have responsibilities to ensure that they are the voices for adolescents, and then they are part of the journey for change.
It brings together young people, healthcare providers, teachers, parents, advocates, and communities to celebrate adolescents and to push for better health outcomes.
Honestly, I am sincerely very flabbergasted. They opened up, they brought up so many issues that is of concern to them. issues around menstrual hygiene, how we can support them, issues around how they can work with government, with their community to improve other health indices, even including polio eradication, even including health facility delivery, making sure pregnant women come to them. Of course, they express their challenges.
Here in Adamawa State, the initiative is implemented through a collaboration between the EU, UNICEF, as well as the Adamawa State government with the motive of improving access to rights-based, adolescent-friendly health and protection services, especially for the most vulnerable girls.
Actually, adolescent is a transition from the childhood to adulthood. And their stage now is very sensitive. One has to model them so that they can give their best to the society. And we as government, we have tried to create a platform for them whereby each and every adolescent will be heard, each and every adolescent will have access to his health. And we have trained our health workers on adolescent and youth-friendly health services.
It focuses on inspiring adolescents and their communities to advocate for a successful transition into adulthood, as well as improving the lives of adolescents worldwide, which is celebrated from 13th to 19 October annually, with the theme Thriving Inside and Out, Strengthening Adolescent Physical and Mental Health for the 2025 edition.
We are equally not looking at the girls alone. We are looking at, when we're talking about the adolescents, we are looking at those that are mostly predisposed to vices. So we felt the girl child is more than the boy child. But invariably, the boys are equally part of this move, because we are talking about the use of substance or use of drugs, and then peer influence, especially in the health facility. And so all of this is a package. That is why I say we are looking at not only the girl child, but we are looking at adolescent and young people.
During this week, there are awareness campaigns, media, social media, community outreach about issues like mental health, reproductive health, substance abuse, nutrition, and the likes.